Thank you for just joining in. If you just did, you're watching Smart 24 TV and SMB. Smart means business. My name is Rita Cabanyoro. For this particular time, this is where we go and seek expert analysis and take you to discussions that are going to be helpful. Not only just helpful, but try to analyze for you, and as well as getting inspirations and also movements or locomotions towards your sustainability in your business. But for this time, we're going to take a look and still on the conversations of oil and gas in the country. We're going to look at how beneficial is it for the health sector in the country vis-a-vis how health sector benefits oil and gas. In that regard, joining me now is Dr. SHANNON who is working with NTINDA Hospital. Thank you so much for joining us. It's a very good morning indeed.
A pleasure. Good morning.
And I happen to know you from the convention. How was it like? If
the convention.
Start from there.
Oh, thank you. We are part of the group known as NTINDA Hospital joint venture with a South African company known as International Holdings in Johannesburg.
Oh, that's from when you were participating.
Yes.
And now let me take you to the first query that we want to understand. As the health sector, what opportunities do you see from oil and gas?
Oh, thank you very much. It's amazing that there is a seismic change in the economy of the country, especially after the signing of the FID early this year. We thank the government for having achieved that. It's going to open up a whole spectrum of investment opportunities in the country. So as a health practitioner, I want to advise our colleagues that it is time to get on board. We have, as a government, it has done its part. Now it's the business sector, including the health practitioners and the health system. We should get on board to see that things get moving and we get our share of the revenue that is coming out of the oil and gas industry. At the same time, we shall be improving the health sector in the country.
Okay, what share are we speaking about here?
Share in terms of we may be very small players. Okay. We may be very small players in terms of the percentage of revenue that is coming to the health sector. But in gas, there's nothing small. Okay. In oil and gas, there is nothing small. We are talking something small, maybe a subcon or a subcontract. You may be getting about $1 million US, because the whole package may be about $40 to $400 million. So if you get just a fraction of it, it's still big money. So I advise my colleagues in the health system, please come on board and see that we benefit and also we benefit the system.
Okay, and I want us for the viewer to understand clearly, because from the experience I had a day before, as well as the other day, 2 days at the convention, you hear people highlighting how some hospitals have been, shortlisted to take a contract part in the oil and gas. What services are we going to be expecting here? If you could guide us through those lines.
Okay, like I previously alluded to, there is no industry that does not have an attachment to health. Okay. You need a healthy workforce. You need to prevent occupational hazards. Occupational hazards, I'm talking about accidents. Someone is putting up something and then he or she falls. The spanners they use, or the tools they use in the industry of oil are very heavy. A simple spanner, maybe 2 kilograms. If it fell on your head, you would definitely either lose, have a damage to your spine, or a fatality like a fracture, that is breaking of the bones. So we are there to, first of all, prevent such incidents happening. If they do happen, we must have facilities in place to handle the emergency. If that emergency is overwhelming, it should be able to be transported as quickly as possible, either by road or air, to the next best facility that can provide the services. You may get another incident like, those are accidents, but then food poisoning. These camps are going to have about 4,000 people, and they'll be eating in a common pool. If the food is infected, there's bound to be an outbreak of diarrhea. That is an emergency. So there are many, many facets where it is key that you have a proper health system in place.
We get the picture now, Doctor.
You're welcome.
And if you could share your experience from your perspective, you were there representing a company.
Yes.
I tend to believe or think, I stand to be corrected, that you were going there to break deals for anyone that would want to come on board.
Yes.
Under what regularities and legalities are you following to make sure you're part of the main contractors in the health sector?
Oh, thank you. We got inside information that there are opportunities or subcontracts which involve the health practitioners. Some other organizations jumped on board earlier. They had the information before and they went there first. But then we also are coming in at the right time. We may come in as a subcontractor, but soon when they see the efficiencies of our system as a company, ATA and NTINDA joint venture, then they'll realize that, hey, there are other players who can offer similar or even more advanced services. So we come in, we came in and we had a booth at the convention. We showed or we displayed.
You were exhibiting?
We were exhibiting, yes. We were part of the exhibiting team and we exhibited them and we had a very, very good and positive feedback from the people, the big players. We had a representative from McDermott who visited our store. We had a representative from PAO, that is the Petroleum Authority of Uganda. They visited our store. We had the China, Sinopec, the biggest player from China. They visited our store and they got keen interest. So we expect that since we have been advertised or we've been given the platform to show what we can do, we are also asking for other players in the industry, in the health system, to please come on board. Oil is a big, big thing. It's like an elephant. You can't eat it alone. And
what do you need to get on board? For example, if and for the public interest, when we speak about McDermott, Sinopec, these are some of the big contractors that have been, put on board to make sure they subcontract others. So it's for the public interest here. What do you need to get on board on those major contractors? If we speak about regularities and legalities, what is required of you? Okay,
you must be, first of all, registered by is it called the Uganda URSP?
Yes, Registration Bureau.
The Registration Bureau. So you must be a legal entity as a company. Then you must have all the paperwork in terms of qualifications. In terms of, you must also, as a health unit or entity, you must be registered by the Uganda Medical and Dental Practitioners Council, which is under the auspices of the Ministry of Health. All your staff, the technical staff, must be registered with the Ministry of Health. Then you must be on the National Supplier Database of the Petrol Authority of Uganda. Okay? So those are the key. And then you must have the ability to perform. You must have financial backing, either guarantees from the bank or your money.
Okay.
Bank statements that prove that you have the capability of handling such scope of work.
Okay. Now let us go to the key one that at least I have heard from a number of people at the convention, the Petroleum Authority database.
Yes.
How do you get there?
It is a process. First of all, you must show you have a Ugandan either partner or you yourself as a company, you're registered in Uganda. Okay? So there is an emphasis on national or Ugandan content. Okay? Because if that was not done legislatively, it would lock out very many Ugandan companies because they do not have the capacity to compete at international level. Although for us we have ISO 9001. We are accredited internationally. Then, so that is on the database, isn't it? And then, of course, it's a whole set of questions. It's a whole questionnaire. If you satisfy, the regulations also, NSSF, you must have NSSF clearance. You must have URA clearance.
And with NSSF and URA, that entails with all your staff.
Yes.
Isn't that so?
Yes, you must be compliant with all the regulations of that.
All right.
Yes.
At least we've got an idea on how you get onto, to break a deal with the big players or big contractors here. And one of the challenges someone was telling me earlier on, a day before, was one of the needs is that you must have new equipment. Especially if you're going to be subcontracted or subcontracted towards the oil and gas activities.
Yes, please.
Does this cross to the health sector as well?
Absolutely. Absolutely. So this is part of the package that proves that you have the technical know-how, you have the equipment, you have the staff.
Okay.
Okay? And there are pre-inspections that have got to be made to satisfy your contracting partner that you have the capability of doing this. If they come and find that you have ramshackled equipment, they cannot trust you. It's all about gaining trust and compliance.
Okay.
Thank you.
And now let's talk about maintenance. Maintenance of this equipment, you in the health sector, it has got a lot to do with baby equipment. There is scanning. You talked about the incidences of emergency cases. Here I am thinking about the ambulance there. How capable are majority of the companies willing to participate here in regards to maintenance, or it is now high-ended firms that are able to manage this? Please show the viewer a perspective here of participation.
Thank you. That's an interesting question. Maintenance of equipment is key, is critical, because it involves the initial purchase involves a lot of capital expenditure. Okay, so for instance, a modern ultrasound scan may cost up to $400,000. That's the cost. Then the installation is another cost. It may take you about another 50 or so US$ for installation. Then you must make a maintenance agreement with the supplier, because that equipment needs to be maintained on a regular basis, either remotely or by flying in the people who sold it to you. So you must have a plan, the purchase plan, the maintenance plan, and of course the disposal plan after that. Okay? So it's a whole cycle. It's a whole cycle you have got to be prepared about.
Okay.
Yes.
Does that mean that a startup here, I feel like it's excluded from this kind of participation? How true is this?
Well,
because if you're speaking about an ultrasound, for example,
yes.
if we even speak about an ambulance purchase, if we speak about equipment here that has to be done,
yes.
I feel like someone who is there is already scared. Should they continue the worry?
Not really, not really. You may start small.
Okay.
You may start small by getting a sub contract.
Okay.
And you concentrate just on ambulance work. You concentrate on just clinical work in a small clinic inside the industry. Or you may come in big, like we are coming in big, because we even have helicopter emergency medical services. We're going to be the first.
Okay, we're going to get there.
Yes.
We're going to get there to
Yes.
the cost.
Okay. So you can fit it at whatever level. At whatever. So I advise you to get on the National Supplier Database, put on what you can provide, and then continue bidding as you build up your portfolio.
Okay.
Yes, please.
And now let us drive to what even you were highlighting for us.
Yes.
Where do you get the confidence that you're going to bid and win for all these contraction work, Doctor?
Thank you very much.
As a company.
As a company, first of all, personally, I've been in the diaspora for the last 20 years. I've been working in Namibia and South Africa for the last 20 years. I just returned about 6 months ago. But then I returned because I had this good business happening in Uganda. Initially, there was not much to attract me to be home. Okay. I was being paid very well in Namibia, and then I said, no, see if there is this opportunity, why don't I go home and also participate and make a contribution to the health system in Uganda? So, fortunately, during those 20 years, I've made a lot of contacts. I made a lot of contacts. And that is how I met this team of International Holdings of South Africa. We had a conversation, and then they said, yes, we're coming on board to give you the backing that is necessary to operate with big players. Okay? So, joint ventures is key. Nobody has the capacity to handle these projects alone. Okay? Joint ventures are the key to entry. So now we are going into partnership with these guys from South Africa, and then we are linking up with also United Health, which is already here with Case Clinic. Okay? So like I said, things are big. Case alone and United Health cannot manage running a camp of about 5,000 people alone. Okay? It's a strain. And then there are many other camps that are going to be built. So I think it is a start, and it's a good one at that.
Okay, take us through the capacity. You were highlighting you're going to be the first to implement helicopter.
Yes.
Please.
Oh, thank you. First of all, we do what we provide medical staff and their training, from specialists to the nurses, to the paramedics who work in ambulances, to the laboratory staff. We have the capability, both local or Ugandan and expatriate. If we cannot get the required staff, we have the capability to import it. Two, we do what we call medical and rescue training, because there is a lot of chances of rescuing people who have gone into a disaster in the oil industry. We have that capability. Then we provide medical capital, like the scans you're saying. We can procure them and all the necessary equipment from the best suppliers in the world, from Siemens, South Africa.
So you're highlighting for us your strength.
Yes.
I want a part of the helicopter.
Oh.
You are highlighting. You are the first people in Uganda, in East Africa. Where do you drive your strength? And take me through that experience of the helicopter.
Yes.
And given that factor,
yes.
Who is to meet the cost here? Okay.
Oh, thank you. What is in existence in Uganda is what we call fixed wing aircraft ambulance services. But then they are not as versatile, or they cannot reach certain parts in Uganda. For instance, in the mountainous areas of Rwenzori or Bunyoro, you may not be able to have fixed wings picking up clients or patients. For us, our strength is that with a helicopter, it can land anywhere. It can land anywhere. So if there's an emergency in any terrain, we are able to land, pick up the patient, and deliver him to the hospital. Now we're having medical ambulance helicopters, not just a plain helicopter like UPDF has. No, ours are equipped to start handling the patient from the time of picking up, stabilizing him.
So the helicopter has got first aid inside.
Yes.
Are you telling me it has got a hospital ready inside?
Yes. It is specially built with all the facilities, like in an ICU. You know what ICU is all about?
Please. That
is intensive care units. So we handle the patient right from the beginning, from the site of the accident, in flight, in transit, and then by the time we are landing in the respective hospital. Some hospitals even here have facilities for a helipad. You can land in the hospital itself. So there is no delay, and the chances of someone dying in transit are very, very much reduced.
Okay.
So that is the capability we have.
Oh, that one is a huge one indeed. But then who meets this cost? Okay, from the public opinion to know.
The cost, in oil, most of the oil patients are going to be paid for by medical insurance. Okay, medical insurance, or the companies who have the contractors. Now, we are not only going to be providing this service only for the oil industry. It's going to be available even to other businesses. If you have an accident, say in Kisoro, you can always call us, and we go and pick you up, even if you don't work in the gas industry, as long as you have the facility of insurance, medical protection, or cash. If you have the money yourself, you will be able to pay for that service, and we offer it to you.
Okay.
Yes, please.
And we mentioned earlier on from Dr. mentioning Case Clinic. Just for your opinion and your knowledge around there, Case Clinic is one of the major contractors that has been contracted to offer medication or health facilities for oil and gas. There has been other major contractors, like I mentioned earlier, CNOC, UNOC, Total Energies, Case Clinic is representing the health sector here. As we still discussing in regards how the two are benefiting, that is in regard to oil and gas, to health sector, vis-a-vis health sector to oil and gas. Now let us speak about sustainability, because there is one thing of you coming on board and then they have given you a contract, or they have subcontracted you, and then it is another story for you to maintain that and, you know, continue doing that particular service. First, take me through how ready are you as you come on board to make sure you sustain these services?
Oh, thank you. First of all, NTINDA Hospital has been in existence for nearly 11 years. Okay, we have a hospital based in Chigoa in NTINDA, and it's a 50-bed hospital. So we are providing both inpatient and outpatient facilities. Now, our partner from South Africa has been in operation for the last 10 years as well. And for him, or for that partner, he has the capability, he has a footprint in 34 African countries, from the SADC region, East and Central Africa, West Africa, and North Africa. So he has the experience and the technical know-how and the financial resources to be able to run an operation here in Uganda. So as we progress, we are not new starts. We've already been in the service, in the industry before. ATA is operating in Congo, it is operating in South Africa in the mines, it is operating in Mozambique in the gas industry, it is operating in West Africa, Nigeria in the oil and gas industry, in Morocco and in Libya. So 34 countries, that is our footprint in Africa. So they've already built up a reputation. They've built up a reputation which is sufficient to enable us to start.
Okay, I very well understand that is a great strength there. And you highlighting you being in Congo, Namibia, and others. What experience do you borrow from there that is going to be implemented here as we move forward towards our oil and gas participation?
Oh, thank you. I have been lucky, I have been fortunate to run big hospitals. I ran the second biggest hospital in Namibia as the medical superintendent. It had a budget of $100 million per annum. Okay? So that's big money. I've been handling projects at that level. So it's nothing new. I am the one who built up a nuclear medicine department, which cost us nearly 100 million
in Namibia.
In Namibia over 5 years. So I've got the expertise. First of all, the clinical expertise. I've been practicing medicine for the last 35 years. Then I've been in management and administration of those big hospitals. I ran a regional medical health system in Namibia. So I am someone who has the experience and the technical know-how of how to handle big projects. So that should not be a problem. And I wish to bring that experience into Uganda, both in the oil and gas industry and elsewhere, to see that whatever I do is competitive and it will not shame the Ugandan.
The reputation as well that you have got.
And the reputation that I have got.
Okay, before we go for a break, take us through what someone needs to know for a sustainability call towards oil and gas projections and activities. Because a number of people are coming on board, but how prepared should they be as they tap into these agreements?
Yes. So, first of all, you've got to be smart, like your TV.
Thank you. We'll take that credit.
Because smart represents, it is, you've got to look at the financials, be prepared for them. You've got to have the human resource. Human resource is key in running any system. Then you've got to have a forward-looking philosophy, okay? That let me to not only think about 2-3 years ahead. You are supposed to be 5 to 10 years ahead. Okay? With that in mind, be prepared. Consult a lot, get a lot of references, and then network. Don't think you're going to do anything alone. It's impossible. Don't think you're going to do anything alone.
Nothing
you must
can
be ready.
Alone.
No, you must be ready to bring on either partners, to bring on technical know-how, to bring on advice from people who have been in the industry for a long time.
And that drives me to, what if my organization, my firm is able to handle all these activities. For example, if we were to speak about health, I'm able to provide emergency facilities,
Yes.
I'm able to run then treatment,
Yes.
I'm able to do all that I can deliver, and then I feel like I don't need anyone else. Can't I do that
Never,
myself?
never. You're too small in the oil and gas industry to be standing alone. It's impossible.
please.
So the advice, like I've alluded to before, be ready to partner.
Okay.
Don't go it alone. Yes, please.
All right.
And our I have a philosophy, and in our company we say, invest in health, create wealth.
Investing health or investing in health
Investing in health
creates wealth.
creates wealth.
Let that drives us into a break. We return, but we're still speaking about sustainability in the health sector and how it is integrating with oil and gas sector in the country.